Assalamu alaikum and a very warm welcome to the telethon, which is live from Baitul Futuh Mosque in London for the Masroor Eye Institute of Burkina Faso near Ouagadougou, the capital city. What a lovely day it is. We're going to talk about what this great project is all about. This is the model of this great institute, and it's the main complex really. The facade looks beautiful, and with me is Sadr Sahib and Sarullah to explain to us what is what.
Very quickly, I would explain right from the beginning. On this side is the main road to Ghana. On the left is Ouagadougou. On the right, the road goes to Ghana. The institute in itself, the plot is about 15,000 square meters. It's a double-story building, 14,000 square feet covered area. And on the right-hand side, if you look at two wings, this is the right wing and then the left wing. On the right-hand side, on the ground floor, you have two operating theaters. There is an 8-bedded ward. There are facilities for doctors, nurses, sterilization room, changing rooms, store, and a nursing station. On the left-hand side, on the ground floor, you will have offices for opticians, optometrists, ophthalmologists, clinics for ophthalmologists, a laboratory, administrator, and general store. On the first floor on the right hand side, there are further 5 private studios which can be used as private rooms or also for the visiting ophthalmologist of the international faculty who will be going there every month. It also has extra clinic rooms available there which can be used. And on the left hand side, the top floor is 250 seat auditorium which is directly connected to the operating theaters. So you are able to do telemedicine essentially. They can be transmitted to that operating theaters up to the auditorium, or also if you want to take pictures and have consultation remotely with an ophthalmologist of the international faculty. In the middle is the lobby. On the ground floor, as I said, there will be various offices, reception, medical records, cashiers, and on the first floor there are various seminar rooms as well, in addition to IT control rooms which are there.
We hope that you can get a better insight and understanding of this scheme and what it will actually mean for those people on the ground, those people who are unable to see, those people who depend on us in wealthier nations to help them. It's not only our duty, but it's their right for them to be helped. Dr. Saab, you've been to Burkina Faso many times. You've seen the situation on the ground. Tell us about the situation there and the provisions that the Jamaat is going to be able to give to the people of Burkina Faso through this special eye institute.
Burkina Faso is a very poor landlocked country, and the eye diseases are rampant being in the sub-Saharan area. Even eye diseases are rampant in children. The facilities there are rudimentary. Even the medical college does not have the facility to treat posterior eye illnesses like glaucoma. So mostly the treatment is focused on anterior eye illnesses. Free treatment is not available. Mostly people have to go to private, or even in government hospitals they end up paying. And cost of even one cataract operation can be anywhere between 130 to 160 pounds. So you can see that people are not able to look after themselves, earn their living, if they lose their eyesight.
So according to UK standards, £130 has a certain value, but in Burkina Faso, can you give us some context to how much does £130 mean to a person in that country?
As I said, £130 would possibly be more than their yearly wages. So I think it is to put things into context. It's an extremely poor country, and people have to travel far and wide to seek any kind of health, and particularly specialist illnesses for like eye illnesses as well.
So if it's a year's income, the only option they really do have is to be blind.
Be blind, yes.
So this would mean a change in circumstance and a change in opportunity for someone who really is desperate.
Yes, it would not only change their life, but change the life of all their family, because they are the earning members. They won't be able to earn their livelihood or look after their family or feed them. So it is a huge sadaqah-e-jariyah, and I've been there multiple times, and I've seen with my own eyes the difference it brings to people's lives. I have seen women who had not seen their children, and for the first time were seeing their children because they were blind or had had cataract and lost their eyesight. Similarly, I've seen children who were not able to see their parents, and they were able to see their parents for the first time. So it is a huge sadaqah jariyah. If people are able to donate and assist, it would be a blessing.
So, I mean, these people aren't just numbers. We have to understand that this is a family.
Yeah.
These are human beings. These are people just as we love our children.
Yeah.
Those same people love their children.
Yeah.
But they just haven't got this facility. So through this Masroor Eye Institute, what kind of change can you bring about in this country?
The aim is to provide eye treatment which cannot be which cannot happen at this time in Burkina Faso when people travel outside of Burkina Faso. We will be doing, inshallah, free operations as well, subsidized operations as well, and those who have the ability to pay may end up paying something towards the cost. But as I said, majority of the people are not able to afford it at all. We would also like to train, the aim is to train doctors and paramedical staff and enhance their skills so they are then able to continue doing these operations and treatments all year round under supervisions of the international faculty of ophthalmologists, of Ahmadi ophthalmologists, inshallah, which will supervise this going forward.
With regards to the site, we're going to be watching some footage very soon about the construction and its history. Can you just give us a brief history of the site and how it was started?
As I said, the site was purchased, it's known as Bostane Mehdi, which was named in 2005. The site was purchased in 2000 following a dream of Hazrat Khalifatul Masih Rabi Rahimullah. And once the Jamaat has given this piece of land, about 3 to 4 acres, to Masroor Eye Institute, where this would be built. And I would also like to mention the great support Burkina Faso Jamaat has been towards this project. In particular, I would like to mention Amir Saab, Burkina Faso, Mahmoud Nasser Saqib Saab, and Abdur Rahman Jialo Saab. Without these two individuals' particular assistance and help, I don't think this project would have gone forward.
So let's go straight to Burkina Faso. You can see with your own eyes the developments that are taking place and the type of institute that is under construction.
मुझे देख तालिब मुंतज़िर मुझे देख शक्ल मजाज में.
It is in the middle of West African countries, so clearly not just serving the people of Ouagadougou or nearby areas, but all the neighboring countries as well. And this place is equidistant from other capitals of West African countries, which is quite a special place to be. And also, he gave some shocking statistics that 400,000 plus people within Burkina Faso, a small country, are blind. And the population is 20 million, so that's about 2% of the population is completely blind. And 70% of those blind people are blind because of cataract, something which is quite easily treatable if is treated in time. And also he mentioned about how big difference it could make to the people of Africa who are extremely poor, and the beneficiaries are not just within Burkina Faso, but from other countries also.
They are very content with life. They don't make a fuss from what I've seen. Mm-hmm. And these people have huge needs. They're not like me and you where we worry about the latest iPhone or this gadget, or the stress that you see some children have where they can't find a socket to charge their mobile phones. These are people who have very, very basic needs. And if we can fulfill these basic needs for these people, it will go a huge way. You can see a source of employment. Once you can see, you can start to find employment, education, finding water, basic things that we take for granted. Inshallah, through this institute, we should be able to have those changes in these people's lives.
Yes, of course, living here in the West, what is the comparison of the medical life within Africa? What did you come up with seeing what is on the ground?
So one thing that strikes me when you ask me that question is I remember in one West African country where there was a patient who was in a wheelchair with bandages across his feet, bleeding. And he had no means of paying for his operation. He'd just been through a car accident. And the only means that he had to pay for his operation was to beg within the car park of that hospital. That's how dire things are in Africa.
My motivation is to help humanity, because that is the basic purpose. This is what we are raising funds for. And there's a lot of very important causes that we need to donate to. And of course, today we are here for the Masroor Eye Hospital in Burkina Faso. And as we've heard earlier, that it is a country where there's a huge amount of problems that they have with eye problems. It's a very poor country. And what better service can we give to the people of that country than give them something that they need urgently? And sometimes it makes me wonder, you know, the big organizations give millions and billions of pounds, and yet we've got people in these poor countries who don't have the basic facilities. Where's the money going? At least we know that the money that we raise, every penny of that is being actually invested for the people of those poor countries. And every penny that people pay counts. And I think that is so important that, you know, we should raise as much as we can and help the poor people all around the world. This is not only in Africa, we help people in Pakistan, India, anywhere where there are people in need. Of course, we, you know, have been helping people even in America. In Katrina, our people were there. In Japan, when they had our people were there. In China. So this is true Islam. This is how best we can show the picture of Islam to people around the world, that we are a service to everyone, irrespective of race, color, creed, or religion. We are there for everyone.
It's a pleasure to be here. Jazakallah for having me on. I'm doing well. I hope you're doing well in the UK.
How would the presentation and severity of eye conditions in Africa be different in your view?
Yeah, it's a very good question. You know, eye diseases are eye diseases, and they have different characteristics in different parts of the world. And as you pointed out, being in the United States, particularly in California, I've had the privilege to practice for about 15 years. And over those years, I've kind of got a sense of what the disease processes are of the eye here in the United States. But it was to my surprise when I traveled to Africa for the first time, to Burkina Faso and Mali in 2019, where I really appreciated some of the difference in the pathology, specifically external diseases of the eye. You know, Burkina Faso and Mali are very arid regions in West Africa, sub-Saharan, and there the ocular surface is extremely dry. There's a lot of dust, and that lends to a different type of surface disease that we see over there, and that presents unique challenges. Similarly, and this is true of Guatemala where I've traveled too, disease progression, you see it move much further along before patients get seen. So the severity of cataract and glaucoma is quite striking. And it's something that we take for granted in first world countries like the UK or United States, where people have access to healthcare. So you can treat things at a much earlier stage, and in some ways it's easier. In underdeveloped countries, in places where people don't have access to healthcare, and this is true not just in ophthalmology, but in all medical fields, the disease presentation is quite severe, and it's actually quite striking. And so that was something that I encountered and appreciated in Burkina Faso and Mali in particular.